Hello, my name is Jan Peralta. Today I will be presenting a skill video on prenatal education for a healthy pregnancy. Starting at 4 weeks of pregnancy, or when you find out you're pregnant, you'll have regular appointments until delivery. From 4 to 28 weeks is the monthly appointments. From 28 to 36 weeks, you will have bi-weekly visits. From 36 weeks until delivery, you'll have weekly visits. During the initial session, your healthcare provider will review your medical history, previous pregnancies, family history, medications, and surgeries. They will also provide an expected due date based on your regular assessments, which may include vital signs, especially the blood pressure, blood tests, urinalysis, pelvic exam, including a pap smear, ultrasound, either transvaginal or abdominal, depending on the gestational age. During every routine visit, your healthcare provider will monitor your blood pressure to detect complications like preeclampsia, test urine for glucose and protein to screen for gestational diabetes or preeclampsia. They will monitor the weight to assess maternal and fetal health. Starting at 10 weeks, your provider will use a Doppler to listen to the baby's heartbeat, measure fundal height to check the baby's growth. At 20 weeks, a fetal anatomy scan will be performed where you can find out the baby's gender. From 28 to 36 weeks, biweekly appointments will include routine checks and may also include Tdap vaccine to protect against tetanus, diphtheria, and whooping cough. RhoGAM injection if you are Rh negative. A 1-hour glucose tolerance test to screen for gestational diabetes. From 36 weeks to delivery, weekly appointments will focus on assessing the baby's position, check your pelvic, cervix, performing a Group B strep swab, educating you on recognizing labor signs, and what to do if your water breaks. Procedures during pregnancy would be ultrasounds, an initial ultrasound to confirm pregnancy, determine the due date, and listen to the baby's heartbeat. A 28 anatomy scan to check the organs, developments, and overall fetal health. Additional ultrasounds may be required for growth monitoring or complications. Blood tests that will be checked would be the complete blood count, HCG levels, blood type and Rh factor, and HIV blood tests. Other genetic testings would be NIPT and quad test for Down syndrome, AFP for neural tube defects, amniocentesis or CVS, chronic villus sampling for invasive genetic testing. For pregnancy healthy diet, you want to aim to include an additional 300 calories a day. Your diet should include vegetables that has potassium and vitamin A, fruits that has vitamin C, fiber, potassium, dairy that has a lot of calcium, vitamins A and D, grains with iron and folic acid, protein such as beans, nuts, and meats. And you should drink up to 8 to 10 cups of water daily to ensure that, and also ensure that the food is thoroughly cooked and produce is washed. Vitamins like prenatal vitamins are essential. Folic acid at least 600 micrograms per day to prevent neural tube defects. Omega-3 fatty acids for brain development. Iron to prevent anemia. Calcium and vitamin D for bone health. For pregnancy, they recommend low-impact exercises such as walking, yoga, swimming, stretching, Pilates. You should avoid contact sports, abdominal exercises, and activities that are fall risk. Aim for 2 to 2.5 hours of exercise per week for like 3 to 4 times a week. Weight gain depends on your pre-pregnancy body mass index. For underweight, BMI under 18.5, you gain about 28 to 40 pounds. For normal weight, you normally gain 25 to 35 pounds. And if you're overweight, 20 BMI of 25 to 29.9, the gain weight is recommended 15 to 25 pounds. If you're obese, BMI over 30, the weight gain is 11 to 20 pounds. Common pregnancy complaints and management. So first is nausea and vomiting. Recommended to eat small, frequent meals, avoid spicy or greasy foods, and consider maybe ginger supplements. Stretch marks, you would use maybe vitamin E, lotion on areas with like the belly sides, thighs, to minimize the appearance of the stretch marks. Constipation is another big one. You want to include fiber, increase your water intake, exercise regularly, and possibly go on stool softeners if the doctor agrees. Warning signs to seek immediate attentions are redness, swelling, pain, and warmth in one leg, which is DVT, severe persistent headaches, which may be potential preeclampsia, and severe abdominal pain, which is a possibility that it's a placental disruption. This concludes the prenatal education overview for a healthy pregnancy.